The county that currently has the highest rate of COVID-19 cases is Umatilla County, which also happens to have one of the lowest vaccination rates in Oregon.
Hospitalization rates have been increasing across the entire state as the Delta variant spreads. Joseph Fiamara joins us live now. He's Umatilla County's public health director. Good morning. Thanks for being here.
Good morning. Thanks for having me.
So give us a sense of how the caseload, how are things looking in Umatilla right now?
So in a word, case rates are high. We've been seeing higher case numbers than any time through the pandemic over the last week and a half. And so far, it shows no signs of dropping off.
I mean, is it really as simple as saying this is among the unvaccinated, or is there a deeper meaning to these numbers?
It really is mostly through the unvaccinated. You know, we had 472 cases that were reported out of our office last week. And the initial survey of those cases per the Oregon Alert data, which is the system that houses all the vaccination data for the state of Oregon, 85% of those cases were unvaccinated.
So Umatilla is one of the state's more rural counties. How are the hospitals right now holding up? Do you have the infrastructure to handle the influx of sick patients?
So it's been getting very tight. We have two local, critical access hospitals here in the county. St. Anthony's here in Pendleton did see some very nervous numbers. Right, they were getting very close to being full. They were having many difficulties transferring individuals out. It's something we are very worried about. We haven't seen quite the same surge at the Good Shepherd Hospital, other side of the county, but they all are also seeing an increase. It just hasn't been to the same level as of yet.
So what were to happen, maybe hypothetically speaking, hopefully, if you do reach full capacity in those hospitals, what is the backup plan? What happens?
So obviously the hospitals, have some ability to do some expansion, set up some temporary wings and so forth. But ultimately, the big concern is if they continue to fill, if they continue to struggle with transfers because of filling hospitals in other areas, even for non-COVID related illnesses, the big concern is somebody who needs access to care for an acute issue, whether it's COVID related or not. We're concerned may end up in a scenario where they don't have anywhere to go.
Are you seeing mainly, I mean, the trend we've seen nationwide is that the vast majority of people who are sick enough to be in the hospital or the ICU are unvaccinated. Is that the case in Umatilla?
Yeah, as far as the data I have, I believe everybody who's been hospitalized for this is unvaccinated.
So where then do we go from here to try and increase vaccination rates in the county? It seems like the message that vaccination is what's going to keep you out of the hospital it isn't resonating with certain populations.
It isn't as much as we would have thought, right? But at the same time, we are seeing some slight upticks in our vaccination rates. So that is something we're hopeful about. It is unfortunate that the biggest drivers that we've seen that have changed minds most significantly is when they know somebody in their circle who has been hospitalized or has passed away from this. It's unfortunate that it takes us there to really drive that message home. We just continue to double down on our messaging. We want to make sure everybody has the information they have to make the right choice and really try to cut through all the misinformation that's out there, because frankly, there's a lot.
Yeah. Joseph Fiamara, Public Health Director for Umatilla County. Thank you so much. It's an important issue. We hope it gets better, and hopefully people do get vaccinated, because it's the best way to curb this virus.
It'll get us back to normal.
Thank you. Thank you very much for your time this morning.
Thank you.
All right. Find the latest news and information about the coronavirus and the recent surge on KOI.com as well.
Well, AM Extra and KOIN 6 are